So many already, hi everyone. So let's get started. Many of you have already been aware of the system, how MCCQE1 part 1 works. So it includes MCQs questions and CDM questions. So many already know how MCQs and CDM question works. I already made a video for that. You can go and look into that. And obviously, I will try to cover up a lot of CDM questions in different sessions and do individual CDM sessions as well to have more better idea about CDM sessions. Now coming to one of the very, very important thing, the exam is based on the blueprint that is assess your performance across the two broad categories. Now we are going to talk about the broader categories, dimensions of the care and physical activities, like physician activities, sorry. So dimension of care is basically, what is dimension? So I'm going to explain this whole table, how the marks distribution or how you are going to get the specific numbers or how they are going to assess you on the basis of this division. If you who has already given the exam, they might have a better idea about this one, but who haven't even tried it for the first time. So this is a very good way of getting how you're going to start it. So it's a very like simple way to know what they're going to ask in the exam. So starting from the dimension in the care, they are going to cover the spectrum of the medical care. So this thing here and this thing here. So in the rows and in the columns. So they are going to see what you are going to discuss. I will elaborate it more. Let's see what they are talking about here. So physician activities reflecting a physician's scope of practice and behavior. Now, this is going to be divided into 4 domains, which is assigned as a specific content weighing on the exam. So now dimensions of the care and physician activities. So what is physician activities? Obviously, somebody is coming with some symptoms and signs. You are going to do is what? Make a diagnosis, right? So diagnosis is coming as a physician activity. So like making a proper diagnosis, if this is a hypertension, this is a diabetes, so you need to know how you are going to do the assessments. Assessment means like starting from the physical examination and then history, that physical examination, doing investigation, then making a proper diagnosis. So this is all going to be covered up. Then what is the next step of the physician? How you are going to manage that particular condition? Is it going to be liable under acute condition or is it a chronic condition? Or even this diagnosis, is it going to be covered by some healthy lifestyle, any like behavior he needs to change in his lifestyle, in his diet, in his smoking pattern, in his alcohol pattern? So all of this is going to be covered in the health promotion and the illness prevention. Maybe some diseases are going to be covered by prevention, like talking about vaccination, talking about hand washing. Those things are coming in prevention. So health promotion and prevention is also one of the category, is the dimension of care. And coming from the diagnosis, then you are going to see if it's an acute, if it's a chronic, or it's a psychological aspect. Like a lot of conditions are not just because of the clinical conditions, but also psychiatry. I always mention, when you are going to study about any physical condition, always make sure if somebody is young and having a palpitations, you have to rule out anxiety. This is just a, like example. So you have to know, along with this acute or chronic condition, the psychological aspect. Maybe some patient need counseling, right? So you need to see on the basis of that, what is it needed for. Then coming to the management, then management lifestyle modification, it includes the lifestyle modification. It includes the acute condition, how you are going to counsel or treat the patient who's coming in emergency. Now, the same patient who's coming in the clinic having a heart disease or MI for so long, now he's coming for a follow-up, right? So this is basically chronic. Along with that, how that disease is affecting that person's life. So you need to start with that and see what the management includes. So sometimes it's just include, that's what I always mention, starting from non-invasive, then invasive. So starting from the management, non-invasive means lifestyle modification, quit smoking, quit alcohol, have a proper diet, have a proper exercise. Those comes in the management. Then moving on to the acute, you are going to see which medications he need at this particular point. Chronic, what medications he need to change or what further investigations he need to do at this particular point. Then psychological aspect, if he is having a burden in his life or having any problem in his life, so all of those psychological aspects should be managed along with it. Then coming to the communication, so if the patient is having or going to be counseled for the prevention, how the physician is going to approach, you are going to offer it Not going to start it. I'm going to ask the patient to quit smoking. No, you are going to offer or tell the patient or counsel the patient that the smoking is dangerous for your health. So it is better if you quit it, right? So it's a nice way of asking for the prevention and promotion. So this is basically communication skills, how you are going to talk to the patient, how nice your behavior is, how you are going to approach that patient. This is basically approach. That's what I'm talking about. In QE1, they also see how the patient approaches, talking about their consent, talking about how they are going to see what comes, how this patient started their treatment. Then in acute, obviously it's an emergency. So in emergency, this is different from the chronic condition. If the patient is coming in emergency, there are some liabilities that is going to be treated right away. You don't have to start with the communication, but some you are going to see, talk to them if they are okay, all of these things. Then coming to the chronic, now this patient with the communication problem, now he's coming in a chronic condition like in a clinic or in an emergency setting, wherever he's coming. Now this approach will be quite different from the acute. In acute, you are going to rush to save the patient. Your first priority is saving the patient, or at least preventing any complication that is going to happen. But in chronic, your communication skills will be what happened, why were you not compliant with the medication, or what was the cause of it. So you are going to ask or see what is the hidden agenda behind it, along with the psychological aspect. Maybe the patient is having depression, maybe the patient is having the problem with the medication, so along with that he's starting psychosis. So all of these are coming with the communication. You are going to see if he's having a problem with his psychological aspect as well, like having an impact on daily life, so causing depression or any mania or anything like that. So along with that, in the communication, you are going to see how the patient is behaving, right? So patient is sitting down, the clothing, he's acting, he's making eye contact. So all of this is coming along with it. Then the professional behavior. So this part is little tricky. Now professional behavior is all of those patients who is like hard to handle. Somebody who started crying, somebody who started to shout, somebody who's talking about, this comes in like mainly in ethics, where the patient is like having a problem or some sudden problem that happened. Now you, how you are going to approach that patient and how you are going to counsel that patient, something like talking about the prevention and promotion. So what could be the example here? Vaccination. So if somebody is having a problem with the vaccination, you are going to see how this patient is going to be approached professionally, like professional behavior, like what is the problem, what do you think like that way, what is the what makes you think like that way. So asking about those things, what is stopping that patient or stopping that particular person to getting that prevention or promotion. Now talking about the acute, if the patient is in emergency having already done suicide, so you are going to approach that patient, why did you do that? Like obviously he's in this emergency condition, but if his condition is normal but he's coming in emergency having this acute problem and he is able to communicate, so you are going to see how you are going to professional. Or if somebody is coming in trauma, so your professional behavior is not like you are going to get scared of the blood and start shouting or yelling. So your communication skills is how you are going to approach that patient, starting from A, B, C, right? Then coming to the chronic, so how the patient is coming in the clinic. So you are going to see if the patient is yelling, shouting, I am not getting my time, or I was waiting for so long, now the doctor is not giving me time. So all of this comes in the ethics. So this professional behavior is main a big part of the ethics. Then psychological aspect, if the patient is mania or in hallucination, so you are going to admit that particular patient, checking on their psychological aspect or how they are behaving. So these things come. Now you can see their distribution of the marks is different, coming from the this from here to here. So this is very important. I personally don't know much about these marks distribution, but what happened here is at least you have to cover all of these psychological aspects. I give you a little bit, not psychological aspect, but all of these aspects. So I give you a little bit of idea about all of these things. So whenever you are studying for some particular disease, these are the important points that you shouldn't miss. You are studying from wherever source, like UWord, or studying from other CK, like, to MTBs or Toronto notes, wherever you are studying from one particular topic, how you are going to approach. This is basically diagnosis, prevention, acute, chronic, psychology. So you have to cover all of these things. So anything would be tested, you are able to answer those questions. I hope that makes sense. So this is what is very important for you to understand how a question from a particular topic could be covered. So all of the questions are, sorry, all of the topics are given in MCCQ, and now this thing is going to be assessed from all of those particular topics individually. I hope this answers all of your questions. If you still have any question, make sure you write down any comment below, and I'll definitely elaborate more about it. So this is the basic idea about how they are going to approach from that particular topic. So people sometimes like get confused, like how they are going to assess it, what kind of questions can come from the particular topic. So this is how they are going to assess. This is kind of questions that is going to be taken from that particular topic, and going to be and they are going to assess you from these aspects. So try to cover all of the aspects, whatever you are studying, whichever topic you are touching, try to cover all of these aspects, like acute, chronic, psychological aspect, management. Just knowing about diagnosis, investigation, treatment, this is not the way. Try to read how this is going to be prevent, how this is going, what is the acute treatment, what is the chronic treatment, what is the psychological aspect that is happening, how you are going to counsel this patient. So this communication is basically counseling, right? How you are going to manage. If they are going to ask about the management, this is going to be asked about non-invasive, invasive. So in management, if you can see this, prevention, acute, chronic, psychological, so all of these are covered in management. If you don't write one of them, the management will not be fulfilled, right? So if they are giving you 4 lines, so you have to talk about each of them individually. And then coming to the professional behavior, how you are going to assess the patient. So this is something you have to cover in each and every single topic, whatever you are studying. I hope this answers your all of your questions. So this is very, very important thing. That's why I want to cover it for you guys. If you still have any question, please write down, and then we will discuss more about it. Thank you so much.